Hi, Jack and Jennifer. This is Cindy. I want to go over your discharge medications with you that your doctor has started you on here in the hospital and wants you to continue to take these. So we'll go over the 5 medications that you have prescribed. And then, so we'll start just in general. You want to take your medications roughly the same time each day. You want to store your medications away from heat and light. You want to eat a healthy diet. You want to drink enough water, stay hydrated. You want to be as active as you can be. And you want to avoid alcohol and caffeine. And you want to watch for side effects for the medications. So I'll give you the handouts for each, but I'll go over the basics now with you. So to start with your the 2 that you have been on, we'll just go over those 2 first. So your Synthroid is to add thyroid, to increase your thyroid levels to a normal range, since your labs were low, your levels were low. So for the thyroid medication, you want to continue to take that 30 to 60 minutes before breakfast. You want to take on an empty stomach with a full glass of water. And you want to, for number 2, your Protonics, which decreases stomach acid production. You want to space that away from your thyroid medication. You want to give that a good 4-hour spacing between that. So a good practice may be, if you have a good 4 hours in between breakfast and lunch, to take your Synthroid 30 to 60 minutes before breakfast, and then take your Protonics 30 minutes before lunch. And that should be enough spacing if you can give that 4 hours. We'll start with the metformin as your new one of your new medications. This medication helps to lower your blood sugar. Typical starting dose is what your doctor ordered for you, which is 500 milligrams once a day, and that's with your evening meal. So with dinner, take this medication. It is common that side effects such as stomach upset, diarrhea can occur with this. And so you want to monitor these symptoms. If you have stomach pain, vomiting, you want to let us know about these side effects. So there's a lot of details that we'll go over, but the basics are if you have dizziness or headache or feeling fatigued or confusion, anything like that, you want to go to the ER and get evaluated. But you can keep a log of your symptoms if they're minor enough that you can continue the medication, and then contact your provider. So the 2 blood pressure lowering medications your doctor ordered are the Zestrol, which is lisinopril, and that does lower your blood pressure. You probably want to take this one with breakfast, so we can space out these two blood pressure medications. Space them out. Take the Zestrol in the morning, and then take the low pressor with your dinner meal. So with the Zestrol, or also the generic is lisinopril, You want to watch for any dizziness or lightheadedness. You want to look for any angioedema, which is swelling of the face or the lips or the tongue or throat, any hives, any rash. That's something that you wouldn't go to the ER for. And let us know. So with the low pressure, or also brand name or generic name of metoprolol, you want to take that one with dinner. And they both work by relaxing the blood vessels, so it brings your blood pressure down. So one being Synthroid, 30 to 60 minutes before breakfast with a full glass of water. 2 being Protonix, you want to take that 30 minutes before lunch. 3 Metformin, you want to take that with your dinner. 4 Zestril, you want to take that with breakfast. And 5 low pressure, you want to take that with dinner. So again, all of the medications carry potential side effects that you want to watch for. So additional side effects, a general allergic reaction, besides the swelling face and hands and throat, chest, any wheezing or tightness. You wanna monitor these. So it's important as you're starting the medication. You probably want to avoid driving, avoid heavy machinery while the 2 blood pressure medications are you're getting used to those. Both of those tend to cause dizziness, and when you're changing your position, when you're going from sitting to standing, you want to just take your time, go a little bit slower when you change your position. Those symptoms are common. So all of the medications, it's important to discuss it with your doc if you want to stop them, or if you need to stop them for any reason. You don't want to stop them abruptly. They can cause additional concerns with your thyroid or your Synthroid medication, the generic being levothyroxine. That can, it does also have the potential to raise blood sugar. But stopping abruptly can cause chest pain. It can cause, many things. You don't want to stop it abruptly. So the metformin also you want to take even if you're not feeling well, and you want to continue to monitor your blood sugar. Both of the blood pressure medications, you don't want to take excessive amounts of potassium. And the list that we've included for you has a list of high potassium foods like bananas, avocados. You want to limit those. You want to